Today, we're really excited to have Dr. Daniel Henry from the University of North Dakota present on the history of the INMED program at UND, the Indians into Medicine program. Dr. Henry is someone who we've had the pleasure of working really closely with on our Narch Birch grant activities. Some of you on the call, I know from participating in our Narch Birch activities, whether it's the Health Sciences Summer Institute, or whether it's the graduate certificate that we offer to TCU faculty members in public health. So some of you might already know a little bit about our activities with UND, but essentially we are working together to collaboratively try to elevate the capacities of our tribal colleges and universities in the realm of health sciences, research, and education. So we do a number of programs hosted jointly by the University of North Dakota and AIHEC, the American Indian Higher Education Consortium, to try to enhance both educational opportunities for TCU students and also professional advancement opportunities for TCU faculty and staff, particularly in the health sciences field, with the hope and the intention that by investing in the next generation of health researchers, we can prepare researchers who are culturally informed and aware of the issues affecting Indian country in the health area, and who'll be empowered and enabled through their education to be able to address those issues independently. So that's just a little bit of background on the work that we do together. And I'd be happy to hand it over now to Dr. Henry to introduce yourself, and I can go ahead and take down my slides if you'd like to get yours put up on the screen.
Yes, thank you so much. Bonjour, gakana awia, nibiwi ojawashka agida kumeg nanando ojibwe mok. Daniel Henry, Indigenous, shumokumok, makanakwa ju Anishinaabe, Squajiga, and Dojeba, Makwad Dodim. I just want to say hello to everybody. Ichimigwech, thank you all for being here on this Tuesday. I'm here in the Turtle Mountains right now. It's been raining. It's typical spring as we celebrate our spring here. So we're getting a nice cleansing here on the Turtle Mountain Chippewa Indian Reservation, where I am an enrolled member of. I gave you an introduction of my language. My name is Stands on Green Ground. My English name is Daniel Henry. I am an enrolled member of Turtle Chippewa Indians, and I am a Bear Clan. So I just want to thank AIHEC, the American Indian Higher Education Consortium, for allowing me today to come here and just speak a little bit of something very, very dear to my heart, my Ode, and that's the INMED program. I'm going to share my slides here real quick, and then we'll get going. Okay, can we see that?
Yep.
Okay. All right, awesome. So just a little bit about myself. I'm the director of the Indians into Medicine program, as well as a associate professor within the Department of Indigenous Health at the University of North Dakota. I'm coming upon my third year. I started as a co-director in June of 2022 under the leadership of Dr. Don Warren. Maybe some of you know of him. He's actually now doing big things over at Johns Hopkins, as well as so continuing what he's doing, and I'm trying to continue what he kind of started here at the University of North Dakota. I have been a part of the Indians into Medicine program since I was in 7th grade. And I'm not going to tell you how old I am, but if you can tell by the gray, I'm up there in age. So I've been around the INMED program just as long as it's been around. And how I got involved with INMED was my father, Larry Henry, was a coordinator of the Summer Institute program that we have at INMED, and we continue to have at INMED for our middle school and high school American Indian Alaskan Native students who wish to work in an allied health profession. You know, a note on that is when I was in 7th grade, I attended the Summer Institute for the first time. We were asked to write down our goals. And one of the goals that I had, and I don't remember it, but my father does, one of the goals that I had written was that I want to be the director of INMED someday. And lo and behold, 30 some years after I wrote that goal, it happened. So dreams do come true. Just when you put it out into the universe. It took me a while to get to where I'm at, but I'm here. And so I just want, again, just thank everybody for jumping on this webinar as I talk about something, again, that's really means something to me, and that's the Indians in Medicine program. So just an overview of the program. INMED was created in 1973. And the whole idea of Indians into medicine came about around 1972. There's two individuals at the University of North Dakota. One was Gary Dunn, who was the UND School of Medicine and Health Sciences Research Director at the time, and Dr. Robert Alchemy. And so they were having a discussion about why UND has not had success with bringing in American Indian students to the med school. In fact, prior to that, there was only one American Indian student who graduated from the University of North Dakota Med School, and that was Dr. Lionel DeMontney, from a enrolled member of Turnmount Banner Chippewa Indians, and he had graduated from UND in 1969. And at that point, he was the first and only American Indian graduate of medical school at UND. And so they came together and talked and discussed how they can recruit, retain, train American Indian physicians, American Indian Alaska Native physicians, and then, of course, get them to the communities that need them the most. And that is the rural areas, the tribal reservations, areas that have many underdeserved population that are in need of health care. And so this response came upon with the termination of what was called the doctor draft. For some of you that are not aware that during the Vietnam War, not only were individuals drafted to serve the various military branches, but also doctors were drafted to go overseas, you know, to help out in the war, but also to help out with the Indian Health Service at that time. You know, we know that Indian Health Service is under the Department of Health and Human Services, which is a federal program. And so in order to get those clinics and hospitals, if you will, staffed, there was a federal draft that was done, which actually was terminated in 1973 after the Vietnam War came to an end. So there was a huge need for American Indian Alaska Native communities to get the health service and good health service, because there was just too few health professionals in American Indian communities at that time. There's too few now, to be honest with you. Too few American Indian health professionals altogether, and there's a substandard level of health and healthcare in American Indian communities. We've seen an increase in that, and our health has you know, gotten better, and you can tell just by our life expectancy. You know, during that time in the 70s, the life expectancy of American Indian male was around 50 to 55, and American Indian female was anywhere from, you know, 55 to 58. Today, we're seeing those numbers increase slightly, not when we're talking about the normal, or I don't even say normal, but the majority of the population in America. Our life expectancy has gone up somewhat. It can be better. And so that's where the Indians into Medicine program comes into play. So INMED is a program that was envisioned to, recruit, retain, and graduate qualified individuals, American Indian, Alaska Native individuals, to become medical professionals, hoping that they would in turn go back to their homelands, their reservations, and serve their communities. Western medicine, using Western medicine knowledge as well as the traditional medicine knowledge that we've known for centuries on this continent, Mikinak, what we call Turtle Island. And so that's what the vision that Gary Dunn and Dr. Robert Elkema had, along with Dr. Lewis Steele. And Dr. Lewis Steele, and I'll get along into into this webinar a little bit more about her, but she was the first director of INMED. She came from Montana, the reservations out there. I believe Wolf Point. I should know this. I should have written it down, but I think she was in that area. And much like me, she grew up wanting to be an educator, being a coach, but also working towards medicine, and decided that that's what she wanted to do. She wanted to become a doctor. And so she was able to enter, UND Medical. She didn't graduate from UND Medical, but she was able to get in there and help start what is now the INMED program, along with Gary Dunn and Dr. Robert Elkema. So there's Dr. Steele there. You can see a picture of her on the right hand side in her younger years. There, she's doing a seminar for some students, and there she is at her honoring when INMED brought her back a few years back. She was also able to attend our 50th, and I was able to sit down with her and have a good interview that you can actually find on the UND webpage, UND School of Medicine and Health Services webpage within the podcast. So I sat down and had a very good, a nice interview with her, just lovely lady, and the things that she has done after her stint with INMED. She ran many hospitals and clinics, in the last one down in the Arizona area, where she was able to retire, and so owe a lot to Dr. Steele, just with the starting of INMED, the template that INMED created, not only for med school, American Indian and Alaska Natives in med school, but just the feeder programs, the bridge programs for the middle school and the high school students, to get that the extra STEM, the math and sciences needed for them to be successful in a career in medicine. So a lot is owed to Dr. Steele. So INMED started in 1973 under grant monies, and the first American Indian doctor to graduate under the INMED program is Dr. Michael T. Vondel, who was Yankton Sioux Tribe, and he graduated in 1976. I do believe he went into gynecology and was serving members over in the Devil's Lake area, the Spirit Lake area, and where I think he's still there today, I do believe. I don't know if he's still practicing, but I believe that's in the area where he's at. So INMED also has a tribal advisory board. Now, back in the day, when it first started, they had a board of directors, and the board of directors were made up of individuals from the area, the Great Plains area that INMED services. So INMED services North Dakota, South Dakota, Nebraska, Wyoming, and Montana, and all the tribes encompassed within those states. And so at first it was a board of directors who would hire the directors and kind of go over the daily operations. Today, we are under and grandfathered into the Indian Health Service budget under the Department of Health and Human Services. And so today we have what we call a tribal advisory board. And again, that advisory board is made out of members from the tribes that INMED represents. there is a council resolution that places these individuals as our tribal advisory board. And their duties, in fact, we're actually having a spring tribal advisory board meeting on campus at UND this Friday. And we're kind of restructuring and regenerating the duties of the tribal advisory board. So I'm actually anxious and excited to see what they come up with. Right now, the tribal advisory board helps with the recruiting of individuals on their own reservations as well as in their state area to help INMED bring in new students and to get them to where they need to be, and that is walking across that platform in May or in December, getting that degree, getting hooded and then going off to work in their communities are where they need to be. So that's the tribal advisory boards right now, is to help with recruiting, help with retention, as well as any legislative support needed. And if all of you know and following along what's happening within the federal government, we definitely need that support as much as we can now. We're finding ourselves, and I don't really want to get off on a tangent and into anything negative, but every day I'm looking at emails and wondering if this is a day I'm going to get an email that I don't want to see from the Department of Health and Human Services and Secretary Kennedy. But being optimistic and be positive, and we're continue to work until they tell us to stop, and that's what's going to happen. We're going to continue doing our duties and our missions until they tell us to stop, and then even then they might have to pry me away from my desk. So that's our tribal advisory board and the history of them. And as you can see, maybe you see some of the individuals there, because they all have made a huge impact on what INMED has become within the 50 plus years. So if we look at the 50 plus years of INMED, way back in 1973, when we first started, there were 26 American physicians identified as American Indian. Today, you see that there's over 3,400 American physicians identified as American Indian. Now, you would think that is a huge, huge step, and it is, from having 26 to 3,400. But we have to remember that the way the census was taken during those years is a little different than it is now. So, for any of you that, we know when the census comes up, I say please sign it. Make sure that your neighbors, your family, do that census, and you put down a head of household. You put American Indian. If you are, even if the head of the household isn't, but the spouse is American Indian, put down American Indian anyways, because that is how those communities, especially communities with a lot of American Indian population, get those federal dollars. So as you can see, in 1973, the American Indian population was 827,000. And again, that's census. Today, it's estimated at 6.3 million. And it's probably higher, but again, we don't have the proper census numbers that we should be having. And so we would see that those numbers were going to be up. From 1973, UND graduated that one American Indian doctor, and that was Dr. Lionel Damani. Today, we've graduated over 290 medical doctors, and this May we'll be graduating another 2. So we're very happy for them. The next year, we have 3 that are looking to graduate, and then the year after that, 7. So we're as you can see, this year and next year is kind of our COVID. We're coming off of our COVID years, and so we had a very short list of applicants during those years, and in the years after COVID, it was amazing to see the list that we have now of applicants. So we're during those years, we're looking at maybe 10 to 15 applications for med school, And now we're getting over the 40 to 50 applications of med school. So we're very happy for that. And there are also other programs out there. There's a INMED in Arizona. There's a INMED in Wisconsin. And there was a grant for this year to have an INMED somewhere in either the Northeast or the Southeast. And of course, we have uh, great program, the YES over in the Washington area. That is, following INMED's template that was created by Dr. Steele and then way back 50 years ago. And so we can see that increase now of American Indian doctors coming to fruition. And for us, we would love for them all to come to UND, but the whole mission for INMED is to recruit, retain, and graduate American Indian, Alaskan Native allied health professionals. And it doesn't necessarily mean they have to come through UND's doors. So we're here to help as much as we can. Again, we serve 22 tribal affiliations in a 5-state area. Now that's 26, actually 27, with the Little Shell tribe in Montana coming aboard. So, so we are growing. So that's our 50 plus years of INMED, as you can see, what has been going on in those 50 years. Here is a map of all our INMED alumni throughout the Turtle Islands, as well as the Hawaiian and Alaska. And we do have a few overseas as well. So within the 50 plus years, we have over 3,000 alumni, not only through UND's med program and our allied health professions and our undergrad degrees, but also through our summer institute programs and our med prep programs. So we're very happy as you can see, you can't really go anywhere without seeing someone from INMED alum. And so that is it. I love this map. I love looking at it, and hopefully one day we can fill it. And I know right now the relationship up with our grandmother, that invisible line, our grandmother country up in Canada too. We'd like to do more up there as well, but policy, and it's usually a taxation policy. It usually plays a part in that. So I do know that there should be a few green dots up there in Canada as well, but this is what we have so far. So I'm very happy to see that. So the challenges that we see still today is just the access of good healthcare within our communities. And not only do we want for INMED, we want to train physicians, nurses, med tech, radiology, occupational therapy, physical therapy. Not only but we also want to train our administration as well. So we do see a lot of social work, getting their clinical social work, clinical psychology, but also MPH, and now with the Department of Indigenous Health, a PhD in Indigenous Health, and hopefully create some administrators as well that can take over some of those clinics and hospitals in very need, and to bring in monies so we can get access to quality health for our American Indian, Alaskan Native population. So some of the first things that we look at, within the college area, and this is, you'll see this in most universities as well, is sometimes it's their first time away from home, going to a big university, and Grand Forks may not seem to be a very big metropolis area, but it can be overwhelming at times. It was for me. I graduated from Turtle Mountain Community High School, where my biggest class was probably 13, and the first class that I went to at University of North Dakota was a calculus class, where there was close to 250 people sitting in a lecture bowl. So it was very, nerve-wracking, and it's like, geez, do I belong here? And it was hard to really pay attention. Of course, did what I had to do. But my next class was a biology class, and there was 300 people in that lecture hall, so it's like, wow, what's going on? So again, it's your first time away from home. It's new things, first time tackling, paying bills, and so and that's what, so INMED is there to help with that support. So not only are we there for financial support, to help you get scholarships and help you maintain those scholarships, but also we're there to support um, uh, a community support. The InMed space. Come on up, have a cup of coffee or a snack, and just talk, and maybe it's a chance to see familiar faces. And if you're feeling homesick, we can do things to maybe help that burden, to get you not only culturally connected uh, back with your community, but also just on campus, uh, so you can do what you came to the school to do, and that was to get your degree. So we're going to help out financially. We're going to help out academically. We have tutors. We're going to get you supplies that you needed. If you have to pay for testing, we're going to help you with that. We call that participatory support. So any expenses that we're looking at, we're going to help you with. We do have stipends for some of our programs. We're going to pay for your MCAT. We're going to pay for any other certificates and that you may need. If you're going to become a lab tech and you need to take that test, we're going to pay for that. Any materials you might need for on-the-job training. uh, you know, uh, um, your any clothing you need, shoes, things in that. We're gonna help you. InMed's gonna help with that support, just to lessen some of that financial burden, but also to help you any way that needs to be done on a financial, academic, or community basis. So some of the programs that we have within INMED that we look after, of course, is our physicians, our doctor of medicine, our Indigenous health. And again, we have MPH and a PhD in there. Physician assistant. We partner with our sister program, RAIN, which is the recruiting of American Indian nurses. And the director there, Barb Anderson, who worked for INMED at one time, and a great relationship with her, and so we're working right now. So with our physician medical school, InMed has 7 seats for InMed students for that year, that class that comes in, and UND takes about 78 students a year, and 7 of those seats are filled with our Indians into medicine students. The PA right now, the physician assistant, we don't have any seats in there, so that's my goal for this year. When I created my goals as director for this year, that is, I want to try to get 2 seats for InMed and range students within that PA program. So if we have any of our registered nurses who would like to come in, get their MRN, and then maybe move on to physician assistant, we're going to have those seats available for you, hopefully in the future. Occupational therapy, we have 2 seats in the occupational therapy department, as well as 2 seats in our physical therapy department. Athletic training, we were able to, our first athletic trainer, InMed athletic trainer, graduated last year, and he was a young man from the Spirit Lake Nation. And so we're very happy for that. And we also have an alumni within our Indigenous health who is an athletic trainer, and right now he is the athletic trainer for the Washington Capitals, who are in the big playoff Stanley Cup hunt right now. So we're very happy for that, to have an alumni working at that in the professional settings in athletics. And so we do know that athletics plays a big part in Native American communities, especially basketball. And so we're hoping to get some of those athletic trainers, physical therapies, maybe go back to their homes and work within their school systems. The tribal colleges now are having the sports programs, basketball, track and field, my home college, Turtle Mountain College, golf and basketball, and I think they're adding on. But there's other tribal colleges that do have an array of sports, and so it'd be nice to train some athletic trainers that can go back and help out those communities as well. So here's our Summer Institute program. We just closed on our applications for this year, and again, we're coming off of COVID years. We were mainly a virtual. 2 years ago, we opened it back up to on campus. We were able to bring in 40 students 2 years ago, another 40 last year, and now we're going to bring in at least 60 to 65. So I know we have 65 acceptance letters sent out, and hopefully we get all 60 to 65 of those backs, and we can have at one time there was over 90 students, INMED students, and this would be in the 80s and the early 90s on the UND campus in the summertime, and so we're glad to get that population back up and to bring those smiling faces onto the UND campus for 5 weeks. And of course, it's extensive training. They're going to go into school. It's not all school though, but they'll be, working on math, science, communications, but also getting hands-on lab experience, bringing in American Indian and non-American Indian professionals to talk to them about some of the jobs that are out there. So they get mentorship. They get to network at a young age, and to see what it takes to go into those fields, and what it's like to be at a college. They get to stay at the dorms. They get to eat the good food at Wilkinson Dining Center. Some of our AIHEC Narch Birch students as well will be at UND during that time, so they'll be that experience as well. And those of you that were there last year know that it's easy. They talk about the freshman 15 at the dining center there, but it's easy to put on a summer 15 at that dining center because it is good. They really got good food there. So not only that, but field trips. We take them on field trips. They're going to be going the 4th of July powwow in Dunseat, North Dakota. We'll take them there. And then at the end of the year, we bring them to the cities, Minneapolis, where they get to go to the museums, Valley Fair. We try to keep it, fun, but also educational. So that's our Summer Institute program. And so we're very happy, again, to get that population above 60 and continue that. And so those are our future allied health professionals, and so very happy for that program. And here's our Med Prep. So our Med Prep program is for American Indian, Alaska Native underclassmen and graduates who are thinking about going into medical school and want to take the MCAT. So the MCAT, it costs money, and so we're gonna pay for that testing. We're gonna pay for the pre-testing. It's a 7-week, again, 7 weeks. It's all virtual, but it's 7 weeks, and you are with instructors who have taken the MCAT, who have done very well with the MCAT, and they're getting strategies. And I'm happy to say that, and I want to knock on wood here, but since the MCAT has been around, the average scores of all our MCAT students have gone up. So, and even 2 points with an MCAT is very, it's hard to do, with MCATs. You're looking at an average score usually is around a 490, 493. And to really get into med school, you need about a 505 515 will get you in there. So we have been seeing students that come in with a score about a 493 average, and when they leave our MCAT program, they're up into the 500s, and that's something that we're very happy and very proud of. And Kathleen Fredericks, who is she's an enrolled member of the Mandan Hadassah Rikara Nation. She's been running that program for over 20 some years, and her template works. And so if anybody is out there, and again, our applications for that have just closed. So you have to get on our website at UND, our INMED website in those dates, and of course, social media. But we've also closed on that. And these students, not only do they get all their materials, get the instruction for those 7 weeks, but they get a stipend. So we pay them for that summer. We pay them for those 7 weeks to increase their scores. And so it works very well. And next is our climb. And our climb students, as you can see there, this is the class of 27. So they will be graduating in 2027. That is our physicians class. And so what climb does, it prepares the incoming medical students on what they're going to expect at UND Medical School. So they get field experience, they get to meet with the instructors, they get brief instruction of the courses that they're going to be taking. They're coming up on campus. We're helping them get housing and get their families situated, whether they may have young children who are going to school. So we'll help them with that. But also we take them also for a week on a field experience. This year we're going up to Spirit Lake in Fort Totten, North Dakota, where they're going to see the clinic. They're going to see the food distribution centers. They're going to meet with behavior health and just kind of see the community as it is. And then, of course, if we can, we get them up to the Quentin Burdick IHS hospital in the Turtle Mountains as well. So our climb gets them ready to start their medical school journey. So they will come on campus 2 weeks ahead of usually the rest of the medical school, get that 2 weeks of preparation, and then they jump full steam ahead right into year number one at med school. And that's our climb program. So I know I think 12:40 was my cutoff, but if you have time, I do have a video that kind of shows our history if you have time for that.
Yeah, I think we have
Okay.
time.
All righty. So this was a video that I put together for our 50th anniversary, and I actually showed it at the United Tribes Summit Leadership in 2023. And you may see people that you know, recognize. All right. So that is INMED history. And I know I did a lot of pictures there in a 5-minute Photoshop there, but you know, a lot of history with INMED, a lot of fun, a lot of work, and we still got a lot more to do. So I'm gonna end with that, but if anyone has any questions.
Please feel free if you want to ask a question, you can use the chat function, or you can go ahead and raise your hand, hop on camera, whatever you prefer.
Yeah. And I see there are a few alumni on this panel that I can see. So I'm just
Really? Can you point them out for us?
well, Adrian, you wanna see her on there? And my participatory list is kind of all off, so
Hello, my name is Davina Spencer. I'm a student at Navajo Technical University. Good afternoon. I would just like to ask to share an email.
Like you introduce yourself.
That's all I wanted to.
Yep, no, I'll put my
Yeah,
email in the chat.
I started it for you.
Okay, thank you.
Hey, Dr. Henry, how are you?
I am fine. How are you?
Good, good. It was so good to see some of those pictures. So speaking personally, like you said, Grand Forks can be overwhelming. Leaving my undergraduate of Tucson, Arizona, and moving to Grand Forks, North Dakota, talk about culture shock, especially the winters. But I honestly would not be here if it wasn't for INMED and the support that I was provided. And I really like the fact of the new part that I heard of was the CLIMB program, which is really great. I know that there were certain number of seats that were, for INMED students. You said 7 per year. I was lucky enough that I graduated with 10 other Native Americans during the year that I graduated. And some of us had to do a modified curriculum just because, I had kids and there were, things that, so I appreciated UND and INMED's advocacy for that. But you said there was only 2 graduating. Was there a decrease in applications, or was it just?
Yeah, there was a decrease. We found during the COVID pandemic, there was a decrease in this class that's graduating now. They started off with 3.
Okay.
2 are graduating this year, and I'm not the one is going to be graduating the next year. Took a year off. So and that happens. And just let you guys know too, med school can be with situation, especially for American Indian, there's certain things that we deal with, especially family. We know that our nuclear family is the extended family to others. So so things do happen, where and of course UND, the med school works very, they work very well with us and help support our students. So if they do need to take some time off, whether it be emergency, especially something that has to do with family, they're very lenient with that and helping out with that. So yeah, when Adrian was there, yeah, it was 5 seats. Now it's 7. And sometimes we're able to get 8 or 9. The next class coming in is going to be 9, because we had another student do emergency leave and starting back with that new group. So even though they give up their seat the year before, it's continued the next year. So yep. And a question in there that if we have seats for the MLT, the medical lab tech, we do have seats to that as well, and we'll help as much as we can to get you into those programs.
Okay.
Okay. Any other questions? Is there anything that I'm missing in the chat, maybe?
I think we are good on the chat. I've been keeping an eye on that.
I just have a question. I'm sorry again. I just have a question for Mr. Henry. For environmental health, do you need to have MCAT?
For environmental health, no. The MCAT is basically just to get into med school, into physician school for the
So
environmental.
basic, so you need to divide it in.
Okay, thank you, sir.
Yep, no problem. Yep. Yep.
Go ahead,
Ann.
Ann.
Thank you for your presentation. I really enjoyed learning so much. I teach in the sciences at on the Rosebud Reservation.
Santa Gleska.
Santa Kleska. I've been in meetings all morning, so I'm sorry. Going
That's
this
okay. That's
um,
okay.
We do definitely have students that are quite interested in pursuing health professions. We do have a nursing program. Do you have someone that we can kind of more closely integrate with so we can align some of our course offerings with what the students need to take?
Yeah, and that's what AIHEC is doing with the Narch Birch Grant. So if you look into and I always mess up this. Is it Izzy, help me up? Is it acetone? Acetone, is that?
The Austinet Institute.
Austinet, yes.
Yeah.
I'm sorry. Yeah. So if you get in there, they do have curriculum. They have courses that align. And that's one of the things that we want to do with the tribal colleges is help them with their curriculum to align with the universities, not only UND, but let's say University of South Dakota. Hey, and thank you for just letting me know that you're from Rosebud and Santa Gleska, because we do have a satellite office at the University of South Dakota that has 2 seats for INMED students in the med school, as well as their other allied health professions there. So University of South Dakota, I believe in Brookings, has a satellite office, INMED satellite office. I do have, in the Rosebud area, I do have some friends down that area who are INMED alum as well. But no, we'll do whatever we can. And if you want to, reach out, my email is in the chat. Send me an email and maybe I can get down there or bring someone down there to Rosebud, not only to recruit some of the students, but to help out. I do consultant work with tribal colleges as well. So to help pattern up their STEM and their curriculum. And so, yeah, more than happy to help out which any way I can.
I appreciate that. Thank you very much.
Yep.
And I can hop on real quick to elaborate a little bit on the Narch Birch programs that we do together with UND. I'm going to put here in the meeting chat. Hopefully everyone can see that. There's a link here. It's the Linktree AIHEC Health link. If you click on that, that'll take you to a web page that has all of the links for registering for more upcoming webinars for the Health Sciences Summer Institute and opportunities for TCU faculty. And that flyer that I put in the chat is for our Health Sciences Summer Institute program. And it's a 4-week program where for the first week and the final week, students get to work on online activities done at their own pace through an online learning platform that we use called Praxis AI. And then they get to spend 2 weeks of the program actually on the UND campus in Grand Forks, taking classes with the Indigenous health faculty and getting to also go to sessions with Dr. Henry to learn about INMED. They get to go to the Indigenous Student Center to see what other kinds of resources UND has to offer. So it's an opportunity for currently enrolled TCU students as well as recently graduated. So those who have graduated within the past year are still eligible to apply. And it's open for students of all majors. You don't have to be a health sciences major to participate, but it's for those who have an interest in health careers and maybe just want an introduction to different ways they could enter a health sciences career.
Okay. Any other questions? All right. Well, if not, I just want to thank AIHEC. Thank you, Izzy, for allowing me to come here, give my spiel on the Indians in Medicine program. Again, I'm going to leave on positive remarks. We know that, not only within research, within minority recruitment, scholarship, but also within our education systems, the TCUs, we're really right now paying attention to what's happening within the departments, not only Department of Health and Human Services, but Department of Education and the Bureau of Indian Affairs and Bureau of Indian Education. But let's keep positive, and again, I'm going to keep working until they tell me to stop, and even then they might have to, pry me off my chair. But I just want to say, Chimigwech, thank you all for being here, allowing me again to talk, and Gigawaba Min Minowa, and we'll see you guys all later.
Thank you so much. Take care, everybody. Thanks for joining.